Quick tip of the day, if you or your client is having some anterior or front of the shoulder pain when overhead pressing, give these two things a try. One, you want to make sure that rotator cuff is getting a little bit of love. Easiest way to do it, grab a lacrosse ball, pop it right on top of your shoulder blade in the backside, go up against the wall, rub that area. You'll probably feel some tenderness in the area. That's pretty normal. Spend about 60 to 90 seconds there desensitizing the area. Next, you're going to grab a ball like this or a foam roller, and what you're going to do is put it underneath your elbow here, and you want to keep the elbow towards the front side of the ball, not let it go towards the back, because as you do the rotator cuff exercise here, you don't want the shoulder blade taking over. You want the motion happening at the shoulder itself. So the second tip there is making sure that elbow stays at 90 degrees. For that to happen, the hand needs to take a slightly upward path as you're pulling that cable or band from this direction. So now my rotator cuff is working and not my shoulder blade or my elbow just bending and straightening. Now, just that will probably make that pressing movement feel a little bit better, but here's how you want to change the form slightly. You want to make sure if they're overhead pressing, they're not shoving the elbow all the way out to the side and pressing this way. That's not a very efficient plane of movement or a very natural plane of movement. You want to bring that elbow slightly in front, and what that'll do is put you in the scapular plane for your humerus to move a little more naturally. It'll also allow you to keep that forearm more vertical throughout the entire movement and not see outwards this way or inwards that way. So to keep that forearm more vertical, you'll be able to press a lot more naturally, and you might be able to change your clients or your symptoms really quickly.